There are 26 million cosmetic and reconstructive procedures. That's just in 2022. And while plastic surgery may be a personal subject for some, we get that, it's also a point of intrigue for millions of us out there. We are so excited to say star of the show, Botched, Dr. Paula Nassif is here. We're also joined by News Nation entertainment expert Paula Frolic. Hi, Paula. Doc, welcome to the show.
Great to be here.
We're thrilled to have you. I don't have to tell you that plastic surgery has shot up. I want to tell our viewers the number. Since 1997, it's shot up 446%. That is insane. We know it's become a common practice, but do you think people should think twice before hastily making a booking for that surgery to go under the knife?
You know what, when it comes to those invasive procedures, you just have to make sure you're doing the right thing. Got to find the right doctor. What is the reason why you want to have it done? You know, and listen, if someone wants a facelift, you know, maybe they're in their early 50s or late 40s, why not? If you want to have your eyes done, you want to maybe be able to breathe better. Again, it just depends on the reason. Now, if you're doing it for the right reason and it's a safe procedure, even though there's risk with everything, then why not?
You've changed lives. Go ahead, Paula.
Also, let's be honest, there's a lot of people coming out these days saying, I've never had plastic surgery, but I've had Botox and filler and da-da-da. So I think the terminology has changed as well, because back in the day, it was like, you did Botox, and nobody would talk about it. It's plastic surgery. Whereas now it's like going to the Quickie Mart.
Would you agree, Doc?
Yeah, actually, it's like Botox like new makeup.
Yeah.
Really?
That's exactly what it is. It's something that is that common. And again, when you talk about your celebrities coming out about that, that's what's happening all the time. But you're right. When it still comes to surgery, though, you know, not many people really want to talk about that.
You worked with a woman who had a large tumor on her face. You called it the biggest and toughest case we've ever had. And you've had some difficult cases throughout the years. That was an impactful story. That's the woman. Look at her picture, and you helped this woman. You changed her life. Do you stay in touch with these clients, Doc?
Oh, yeah, actually, I just did something in San Diego with her, you know, with the hospital that did it, and Sharp Hospital. And I have to tell you, we saw her, and her complete life has changed.
Yeah.
Because can you imagine walking around with that all your life? You know, and, you know, they tried taking care of it in Mexico, but again, this is the thing where it could actually bleed a lot.
Is it like a lipoma?
No,
or
it's
was
called a neurofibroma.
Okay, that is insane. Did she keep it after?
You know, no, we tossed that puppy away.
Okay.
I mean, it was big
Wow.
after we removed it, you know. And again, these are scary procedures. One, you can bleed.
Yeah,
Two,
right.
you know, the question is, the part that I'm always worried about, is the skin on the face going to live? Because we talk about on Botched, you know, ischemia, necrosis, you see me using leeches, do all that stuff.
Like a medieval procedure.
Oh, yeah, we use leeches
Throw in a
all
leech.
the time.
Okay, that's
for blood
interesting.
supply, absolutely.
I'm a little freaked out by that. We'll just keep it moving. But like now we're looking at stuff where it's side effects. So we're talking about Ozempic a lot. And you get the Ozempic face, and you've got like people like there are recent photos of Scott Disick and Jessica Simpson who look just emaciated on purpose, which I might add is insane. What do you do with people who've got Ozempic face or Ozempic body? Because everyone's doing it now. Literally, a friend of mine was at CBS the other day, and he was actually ill and had to wait 45 minutes because everyone in front of him was getting their Ozempic shot.
I mean, this is a trend, and this is going to keep going for, you know, this will be with us for a long time. So if you're going to do it, one, you got to do it the right way. Remember, there are risks with it. But the thing, if you're not having a lot of protein with it, you're not weightlifting, that's when it's not great for you. You have to just be careful how you do it. You have to be managed properly. But now what we're doing for the Ozempic body and face, or basically someone comes in, maybe he's not ready for a facelift or who had a facelift years ago, we're using a new technology called SoftWave. And it's a parallel beam ultrasound, which actually helps lift the eyebrows. It lifts under the chin, the neck, and the right here, the jowl area.
Right.
Actually even helps decrease temporarily cellulite, helps acne scars, fine lines and wrinkles. So then it has another part of it called it's Pure Active, which is a muscle stimulation.
Oh.
So the point is you can be getting the treatment while you have these electrodes hooked up to your butt, hips, and stomach, to actually strengthen, firm, lift, do all that with it.
Seems less
Is that
invasive.
like that weird exercise in the 50s where they would just like wriggle you up like this, and then they'd be like, "You just lost 2 pounds."
You know, that's making you move a lot, burning calories. But,
Yes.
but what this is like,
I'm confused by the difference.
plyometric. In other words, you know what jumping squats are?
Yes,
I mean,
of
those,
course.
those
I do
burst
those a
muscles,
lot.
yeah.
Yes.
So, and I've been doing a lot of burpees recently. So it's the same type of thing. Where you're
Burpees.
actually, you're basically stimulating for 45 minutes. And you're tightening, lifting, firming.
Okay, so it does.
So this is great.
It does
This
get rid of
technology
fat.
is great for the situation, especially, it's also underneath the arms.
Oh.
So this is another, it's FDA cleared for that SoftWave because you don't want to have that scar.
Right.
You know, that big scar when
Yep.
you have to reduce this. So if we can tighten things minimally invasive, non-invasive, and we can help someone, that's the way to go. But to your point, overdoing it where you're getting emaciated and actually dehydrated and losing all your nutrition and protein, that's not healthy either.
Dr. Paul Nassif, we loved having you on the show, sir. We hope you come back.
I'm here all the time. I'll be more than happy to.
We would love that. Thank you
you.
so much.